Hi everyone, I'm Dr. Balnandara and I am the medical director and founder of IV Solution and Ketamine Centers of Chicago, and I'm going to tell you a little bit about ketamine. I'm going to tell you what ketamine is, how ketamine works, and how ketamine could help you. So, first of all, ketamine was actually developed in the 1960s and was FDA approved as an anesthesia drug in 1970. It was around the year 2000 when it was actually discovered to be a very effective and rapidly acting antidepressant. And since then, many studies have come out, and they all actually have proven the same thing over and over again, that ketamine is about 70% to 75% effective for treatment-resistant depression, which, as you all know, is the most difficult depression to treat, and that is depression that has typically failed many medications and other therapies. So, ketamine works a few different ways, and actually every day we learn more and more about how it works, but I'm going to go over a few of the basic mechanisms of ketamine. First of all, ketamine is a very powerful anti-inflammatory agent in your brain. And that's very important because studies have shown that people with anxiety and depression and chronic mental illness have higher levels of brain inflammation. Secondly, ketamine blocks a receptor in the brain called the NMDA receptor, and it alters the levels of a neurotransmitter called glutamate. And that actually is the mechanism that causes that rapid relief of depression symptoms and PTSD symptoms, etc. So that's a pretty amazing and also a very innovative and completely new approach to treating mental illness. Thirdly, and actually most important in my mind, is that ketamine is a very potent activator of growth factors in our brains. One of them, the primary one, is called BDNF, or brain-derived neurotrophic factor. And in this image here, and this is actually an image that was done at Yale Medical School about 3 years ago probably, and this image shows how ketamine can rapidly alter the physical elements of your brain, and particularly the nerves and the nerve dendrites and synapses and things like this. So what we have here in this first image is a rat neuron in its basic state of a healthy brain, no depression, no mental illness, etc. In the second image, this is that same nerve branch in a state of depression, simulated depression. And what you can see, the difference in these two images, is that these little nerve buds or extensions are actually called dendritic spines, have disappeared in a state of depression. So this is your brain with depression, okay? It's pretty remarkable that that happens. Anyways, let's fast forward to this third image, and this is what's amazing. This third image shows the effects of ketamine just 24 hours after one treatment of ketamine. And look what's happened. All these elements that disappeared and kind of atrophied over time have reappeared. They're reappearing. That nerve is changing. That nerve is healing. And that nerve is creating new connections and synapses and creating healthier pathways in your brain. So this is a summary of how ketamine works, and it's pretty remarkable and miraculous. And I've actually had patients tell me that they can feel their brain changing, which is amazing. So there you have it. Ketamine is amazing.